Hello everybody, this is Professor Jing. Today we're going to start talking about applied epidemiology. First, we begin with definition of epidemiology. So, epidemiology is a study of how disease affect populations and what factors influence health outcomes. Instead of focusing on one patient, epidemiologists study group of people to understand who gets sick, where disease occurs, and why some groups are at higher risk. A good example is COVID-19. During the pandemic, epidemiologists found that older adults and people with chronic disease are more likely to become severely ill. They also discovered that crowded indoor spaces increase transmission. These findings help government prioritize vacancies and create public health guidelines such as masking and social distancing. So this example shows how epidemiologists use research outcomes to guide prevention strategy and protect communities. One of the most important figures in epidemiology is John Snow, often called the father of modern epidemiology. During a cholera outbreak in London in 1854, Snow noticed that many cases were connected to one public water pump on Broad Street. At that time, many people believed disease spread through bad air. However, Snow carefully mapped the cases and interviewed residents. He found that people using water pumps that pump were much more likely to become sick. After officials removed the pump handle, the outbreak slowed down. This investigation showed how observation and data analysis could identify the source of disease and improve public health. Epidemiologists study disease pattern by person, place, and time. This helps identify who is affected, where disease occurs, and when outbreaks happen. Influenza is a good example. Every winter, flu cases increases in many regions. Epidemiologists monitor which populations are more affected and how the viruses spread. They also found that flu transmission increases when people spend more time indoors during the cold weather. This information helps hospitals prepare for flu season and supports vaccination campaigns before outbreaks become severe. And talking about incidence and prevalence. Incidence and prevalence are two important measures in epidemiology. Incidence refers to new disease cases during a specific time period, where prevalence refers to all existing cases in a population. And diabetes is a good example. Every year, many new patients are diagnosed with diabetes, which contributes to incidence. However, because people often live with diabetes for many years, the total number of cases remains high, which increases the prevalence. Healthcare systems use these measures to estimate healthcare costs, staffing needs, and long-term disease burden. Descriptive studies. So what is descriptive study? So descriptive study identify patterns and trends in disease occurrence. Those studies do not prove cause and effect, but they help researchers understand what is happening within populations. Cancer registries are a strong example. Researchers collect data on cancer diagnosis across states and age groups. These studies show that the lung cancer rate are much higher in populations with high tobacco use. This information helps researchers recognize smoking is an important public health concern and lead to more detailed analytic study later. Analytic study helps determine whether certain exposures are linked to disease outcome. One of the most famous examples involves smoking and lung cancer. Researchers followed smokers and non-smokers over many years and found that smokers had much higher rate of lung cancer. The risk is also increased with number of cigarette smokes. Because multiple studies produce consistent findings, scientists conclude that smoking was a major cause of lung cancer. These findings lead to cigarette warning labels and smoking prevention campaigns. So, experimental study test the intervention under controlled conditions, and clinical trials are one of the best examples. COVID-19 vaccine trials involve with thousands of volunteers. Some participants receive the vaccine while others receive a placebo. Researchers then compare the infection and hospitalization rate between the groups. The study showed that vaccinated individuals has much lower rate of severe illness. Those findings provided strong evidence supporting vaccination safety and effectiveness. Experimental studies are important because they provide strong scientific evidence for healthcare decisions. Risk factor and causation. So what is risk factor? So risk factor is something associated with higher chance of disease. There are many examples. One of the important examples is obesity. Researchers show that obesity increases the risk of diabetes, hypertension, heart disease, and stroke. Excess body fat contributes inflammation and insulin resistance, which can damage health over time. However, epidemiologists must also consider other factors such as diet, exercise, and healthcare access. Understanding risk factor helps public health professionals design prevention programs that improve population health. Screening program is a good tool for epidemiologists. It aims to detect disease before symptoms appear. Mammography screening for breast cancer is a very good example. Mammograms can identify tumors early when treatment is more effective and survival rates are higher. Epidemiologists evaluate screening programs using measures such as sensitivity and specificity. While screening saves lives, false positive results may also cause anxious and unnecessary procedures. Overall, breast cancer screening programs have improved early detection and reduced mortality in many populations. Outbreak investigation helps identify the source of disease and stop further spread. Foodborne outbreaks are common examples. When many people become sick after eating contaminated food, epidemiologists interview patients to identify common exposure. They may trace the food supply chain and perform laboratory tests to confirm contamination. Chronic disease epidemiology is focused on long-term disease such as heart disease and diabetes. The Framingham Heart Study is one of the most important studies in the field. Researchers follow thousands of participants for many years and identify major cardiovascular risk factors such as smoking, high blood pressure, obesity, and high cholesterol. These findings changes medical practice and public health policy by encouraging prevention strategies such as smoking cessation and blood pressure control. Infectious disease epidemiology focuses on disease caused by bacteria and viruses. During COVID-19 pandemic, contact tracing was widely used. Public health workers identified people who had close contact with infected individuals and encouraged them to isolate or get tested. The goal was to interrupt the transmission chain before more people become infected. Epidemiologists also use mathematical models to predict outbreaks and help hospitals prepare resources. This example shows how epidemiology combines surveillance and prevention to control infectious disease. So housing disparities. Housing disparities are differences in health outcomes across populations. During COVID-19, lower income communities and some minority populations experienced higher hospitalization and death rate. Factors such as crowded housing, limited healthcare access, and chronic disease burdens contributed to those disparities. Epidemiologists study those patterns to understand how social determinants such as income, education, and housing affected the health outcomes. Those findings help public health agencies to design and target interventions for vulnerable populations. Modern epidemiology relies heavily on technology and large data set. Electronic health records allow researchers to study medication use, hospitalization, chronic disease outcomes. For example, epidemiologists may identify patients who are less likely to take medication consistently. Those findings support interventions such as reminder systems and pharmacist outreach programs. Modern epidemiology also uses predictive analytics and geographic mapping to monitor population health more efficiently. As we conclude, epidemiology will continue playing a major role in public health. Global surveillance systems helps countries detect emerging infectious disease quickly. Future epidemiologists will also study challenges related to climate change, aging population, and chronic disease burden. Technologies such as artificial intelligence may improve outbreak prediction and support better health decisions. So the key message here is epidemiology uses scientific evidence to improve lives, guide policy decisions, and protect community worldwide. Those are the topics I want to cover today, and next week we will talk about study design and causality. Thank you.